Hey everyone, and welcome to the deep dive. As nursing students, you're going to encounter a lot of patients with respiratory issues. So today we're going to deep dive into some chronic pulmonary diseases that you absolutely need to know.
We'll be focusing on COPD, bronchiectasis, asthma, and cystic fibrosis.
Exactly. Those are the big ones. And we've got a ton of great resources to pull from research articles, clinical guidelines, and even some personal stories from patients.
It's a chance for us to really understand these conditions, not just from a textbook perspective, but also from the human side of things.
I love that. So before we get into the specifics, can we just take a step back and talk about the big picture of chronic pulmonary diseases? Like, what are they exactly, and why are they such a big deal, especially in nursing?
Okay, so basically, chronic pulmonary diseases are long-lasting conditions that affect the airways and the lungs' ability to function properly.
So we're talking about things that make it hard to breathe.
Exactly, and the effects can be pretty significant. We see things like persistent obstruction in the airways, chronic inflammation, and this reduced capacity to breathe effectively.
And these aren't just temporary problems, right? Those are
Yeah.
conditions that can really stick around.
Unfortunately, yes. These diseases are often progressive, meaning they tend to worsen over time, leading to increasing difficulty breathing and potentially even respiratory failure in severe cases.
Wow, that's pretty serious stuff. No wonder these conditions are such a big concern in healthcare.
They absolutely are. Chronic pulmonary diseases are actually a leading cause of morbidity and mortality worldwide, which highlights just how important it is for nurses to be knowledgeable and skilled in their management.
Okay, so let's dive into one of the most common chronic pulmonary diseases out there, COPD. Can you break down what COPD actually is and why it's sometimes referred to as an umbrella term?
Yeah, so COPD, or chronic obstructive pulmonary disease, is actually an umbrella term. It primarily encompasses two main conditions: chronic bronchitis and emphysema. And it's defined by the Global Initiative for Chronic Obstructive Lung Disease, or GOLAIL for short, as airflow limitation that is not fully reversible.
Okay, so airflow limitation not fully reversible. That sounds pretty technical. Can you simplify that for us?
Sure. Essentially, it means that the airways are narrowed, making it difficult for air to move in and out of the lungs. And not fully reversible means that even with treatment, the airflow doesn't completely return to normal.
Got it. So it's not like a simple cold that goes away after a week or so.
Right. COPD is a chronic condition, and what's important to note, especially for nurses, is that it's often progressive, meaning the symptoms tend to get worse over time.
So early detection and intervention are really crucial here.
Absolutely. Now, when we talk about COPD, you might have heard the terms blue bloater and pink puffer thrown around. They're a bit outdated, but they can be helpful memory tools for understanding the different presentations of COPD.
Oh yeah, I've heard those terms before, but I'm not entirely sure what they mean. Can you explain?
Yeah, blue bloater usually refers to the chronic bronchitis picture.
Okay, so let's start with chronic bronchitis. What exactly is going on in the airways with this condition?
Well, with chronic bronchitis, we're dealing with persistent inflammation of the airways, which leads to a constant cough, often with a lot of sputum production.
Sputum, that's the mucus that's coughed up, right?
Exactly. And in chronic bronchitis, it's often thick, discolored, and purulent, which means it contains pus.
Oh wow, that sounds really uncomfortable.
It definitely can be. And now for the blue part of the blue bloater nickname, it comes from cyanosis, which is a bluish tint to the skin that can happen when the blood oxygen levels are low.
So they're blue because they're not getting enough oxygen.
Right. And the bloater part often refers to swelling, especially in the legs and feet. This can be a sign of right-sided heart failure, which is sometimes called cor pulmonale, and can develop as a complication of COPD.
Wow, so it's not just the lungs we're worried about here. It can impact the heart as well.
Exactly. It's a systemic disease, so nurses need to be aware of these potential complications and be vigilant in their assessments.
Okay, that makes sense. So we've got chronic bronchitis, the blue bloater. What about emphysema, the pink puffer?
All right, so emphysema is the other main condition under the COPD umbrella. And with emphysema, we're talking about the destruction of the alveoli.
The alveoli, those are the tiny air sacs in the lungs where gas exchange takes place, right?
Exactly. And when those alveoli are damaged or destroyed, it significantly reduces the surface area available for gas exchange, making it much harder to get oxygen in and carbon dioxide out.
So that's why breathing becomes so difficult.
Right. And as the alveoli are destroyed, the lungs also lose their elasticity, which makes exhaling even more challenging.
So tell me about the pink puffer nickname. Where does that come from?
Well, the pink is thought to be related to the increased effort these patients have to put into breathing. They often have a flushed or pink appearance because they're working so hard to get air in.
And the puffer.
Puffer refers to a characteristic breathing pattern called pursed lip breathing. Many emphysema patients instinctively adopt this technique, pursing the lips as they exhale to try and create back pressure and improve their airflow.
Interesting. So in a way, they're trying to compensate for the loss of elasticity in their lungs.
Exactly. And unlike the blue bloaters, who tend to have more swelling, pink puffers are often quite thin.
So that's another key difference between the two presentations of COPD. One is more associated with fluid retention and swelling, while the other is characterized by weight loss and a thin physique.
Right. And it's important to remember that these are just general descriptions. Not every patient with COPD will fit neatly into one category or the other, but it's still a useful way to understand the different ways COPD can manifest.
So how do we actually diagnose COPD? What tools do we have to identify it early on?
Spirometry is the gold standard for diagnosing COPD.
Spirometry, what's that exactly?
It's a simple breathing test that measures how much air a person can exhale and how quickly they can exhale it. The results can tell us a lot about the severity of the airflow obstruction and help us track the progression of the disease over time.
That makes sense. So it's not just about listening to lung sounds with the stethoscope. We need that objective data from spirometry to make a definitive diagnosis.
Precisely. And the earlier we can diagnose COPD, the sooner we can intervene and potentially slow down its progression.
Absolutely. Early detection and management are key. Now, I know we've talked a lot about the respiratory symptoms of COPD, but you mentioned earlier that it's a systemic disease. Can you elaborate on that? What other effects can COPD have on the body?
Yeah, COPD can affect much more than just the lungs. It can lead to muscle wasting and weakness, making it difficult for patients to perform daily activities.
So it's not just about breathing difficulties. It can impact their mobility and overall quality of life.
Exactly. And because of the increased effort needed to breathe, COPD patients often burn more calories, leading to unintentional weight loss.
That makes sense. It's like their bodies are constantly working overtime just to breathe.
Right. And beyond the physical effects, COPD can also have a significant impact on mental health. Patients may experience anxiety and depression due to the limitations imposed by the disease and the fear of their condition worsening.
Wow, so it's a truly multifaceted condition that affects patients on many levels. This really highlights the need for a holistic approach to care, doesn't it?
Absolutely. As nurses, we need to address not just the physical symptoms, but also the emotional and psychosocial needs of our patients with COPD.
I think that's a crucial takeaway. COPD is a chronic progressive disease, but it's also preventable and treatable. We have a real opportunity to make a difference in our patients' lives through education, support, and proactive interventions.
I completely agree. Now let's move on to another respiratory condition that you'll likely encounter frequently as nurses: asthma. What are some key things we need to understand about asthma from a nursing perspective?
Asthma. It seems like everyone knows someone with asthma, but how is it different from COPD, and what are the unique challenges in managing this condition?
Well, unlike COPD, asthma is generally considered a reversible airway disease, meaning that with proper treatment, the airflow obstruction can be significantly improved or even completely reversed.
Ah, so that's a key distinction between the two. Asthma is more about episodes of airway narrowing that can come and go, while COPD is characterized by more persistent and progressive airflow limitation.
Exactly. But, and this is important to remember, that reversibility isn't always absolute with asthma. There are cases where asthma can overlap with COPD, creating a more complex clinical picture.
So it's not always black and white. That's why careful assessment is so important to determine the underlying nature of the airway obstruction.
Precisely. And to understand how to assess and manage asthma effectively, we need to understand what's actually happening in the airways during an asthma attack.
So what exactly triggers an asthma attack, and what happens in the airways when someone is having one?
It's kind of like an overreaction of the airways to certain triggers. Think of it as the airways getting irritated and going into a sort of spasm.
So something like dust mites, pollen, pet dander, or even cold air can set off an asthma attack.
Exactly. These triggers can vary from person to person, but the underlying mechanism is the same. When those triggers are encountered, it causes the muscles surrounding the airways to suddenly constrict, making it difficult to breathe.
So the airways narrow, making it hard to get air in and out. That sounds terrifying.
It can be very frightening for patients, especially during a severe attack. And to make matters worse, there's often increased mucus production, which further narrows those already constricted airways.
So we've got bronchospasm, the sudden tightening of the airways, and we've got mucus plugging things up even more. No wonder people struggle to breathe during an asthma attack.
Right. And on top of all that, there's also inflammation, which causes the lining of the airways to swell and become even more narrowed.
Wow, so it's a triple whammy: bronchospasm, mucus, and inflammation. It's amazing that people can even function during an attack.
It's certainly a challenging condition to manage, but thankfully we have a range of medications and interventions that can help. And for nurses, it's crucial to be able to recognize the signs of an asthma attack and know how to intervene quickly and effectively.
Okay, so tell us about those interventions.
Yeah.
What are the key things nurses need to know about managing asthma?
One of the most important things is patient education, particularly when it comes to medication management.
Right, because there are a lot of different medications used to treat asthma, aren't there?
There are, and they come in various forms: inhalers, nebulizers, pills, and even injections. So understanding the different types of medications, how they work, and how to use them correctly is crucial for nurses.
I imagine teaching patients how to use their inhalers correctly is a big part of that.
It definitely is. A lot of people don't realize that there's a specific technique to using inhalers, and if they don't use them properly, the medication won't reach their lungs effectively.
So it's not as simple as just taking a puff.
Right. It's about coordinating the breath with the activation of the inhaler, holding the breath for a certain amount of time, and making sure the medication is actually deposited deep into the lungs.
And I'm guessing there are different types of inhalers, too.
There are. We have meter dose inhalers, dry powder inhalers, and soft mist inhalers, each with its own unique method of delivery. Nurses need to be able to explain these differences to patients and demonstrate the proper technique for each type.
So it's about empowering patients to take control of their asthma management and to feel confident using their medications effectively.
Exactly. And beyond medication management, another crucial aspect of asthma care is helping patients understand their triggers and how to avoid them.
Right. Because we can prevent those triggers from setting off an asthma attack in the first place. That's a huge win.
Absolutely. It's about working with patients to identify what specifically triggers their asthma, whether it's dust mites, pollen, pet dander, smoke, or something else entirely.
And then developing strategies to minimize their exposure to those triggers.
Exactly. And this can involve things like using dust mite covers on bedding, keeping pets out of bedrooms, avoiding smoky environments, and monitoring pollen counts.
So it's about tailoring those strategies to each individual patient and their specific triggers.
Precisely. And remember, allergies are a huge factor in asthma, often the strongest predisposing factor, so taking a thorough allergy history is essential.
Wow, that's a really important point. If we can identify those allergies, we can be more proactive in managing them and potentially preventing asthma attacks.
Exactly. And for those with allergies, allergy medications like antihistamines and nasal corticosteroids can also play a role in managing asthma.
So it's a multifaceted approach. We've got medications to control the inflammation and bronchospasm, strategies to avoid triggers, and allergy management to address the underlying allergic component.
Exactly. And remember, each patient is unique, so their asthma management plan needs to be tailored to their individual needs and circumstances.
That's a great reminder. So we've covered COPD and asthma, two very different but equally impactful respiratory conditions. Yeah. What's next on our deep dive agenda?
Let's move on to another condition that can significantly impact breathing: bronchiectasis.
It sounds a little intimidating, to be honest. What exactly is going on in the lungs with this condition? Bronchiectasis. Okay, so tell us about it. What exactly is bronchiectasis?
It's all about the bronchi. You know, those airways that carry air into the lungs. Well, in bronchiectasis, those airways, they become permanently enlarged and damaged.
Permanently enlarged.
Yeah.
So are we talking like stretched out kind of?
Yeah, exactly. And that damage, it creates a real problem with mucus clearance.
Oh, so the lungs can't effectively get rid of all that mucus that naturally builds up.
Exactly. And that trapped mucus, it becomes a breeding ground for bacteria, leading to these chronic infections and inflammation.
So it's kind of like a vicious cycle. Yeah. The damage leads to mucus buildup, which leads to more infections, which leads to even more damage.
Exactly. It's a vicious cycle, and it can really take a toll on a patient's lung function.
So I'm imagining the symptoms must be pretty rough. Are we talking about those persistent coughs, difficulty breathing, and even those thick secretions we talked about earlier with chronic bronchitis?
You're right on the money. The symptoms can be very similar to chronic bronchitis. And in fact, bronchiectasis can actually develop as a complication of chronic bronchitis or even other respiratory infections.
So it's not always just a standalone condition. It can be part of a bigger, more complex picture.
Exactly. And that highlights the need for a really thorough respiratory assessment,
Hmm.
you know?
So nurses really need to be asking those right questions, listening carefully to those lung sounds, looking for any red flags that might point to bronchiectasis.
Exactly. Got to be detectives.
Like that. So what are some of those red flags? What should we be particularly attuned to when we're assessing a patient?
A chronic cough that produces large amounts of sputum is a big one,
Yeah.
especially if that sputum is purulent, thick yellow or green.
Right, that's a sign of an infection.
Exactly. And also, any reports of coughing up blood, that's a serious symptom. It's called hemoptysis.
Okay, so coughing up blood, that's a huge red flag.
Yeah, it warrants immediate attention and, further investigation.
Right. Definitely a sign that something more serious could be going on. So we're watching out for persistent coughs, changes in the sputum, and any signs of bleeding. And I'm guessing recurrent respiratory infections would also be a concern, right?
Absolutely. If a patient has a history of, frequent lung infections or pneumonia, that's definitely something to consider.
Makes sense.
Yeah.
With all that mucus buildup, it's like a welcome mat for bacteria.
Exactly. And that's why early detection and intervention are so crucial. They can make a real difference in slowing down the progression of bronchiectasis and preserving lung function.
So what are some of those interventions? How do we diagnose and manage bronchiectasis?
A high-resolution CT scan is the gold standard for diagnosing bronchiectasis. It can clearly show those dilated airways that are, the hallmark of the condition.
So it's not something you can just diagnose with a stethoscope or even a regular chest x-ray. We need that specialized imaging.
Right. We need to see what's happening deep inside those airways. And once bronchiectasis is diagnosed, the focus shifts to managing the symptoms and preventing further damage.
So what does that management look like?
Well, much like with COPD, airway clearance and infection control are really important.
Okay, so those chest physiotherapy techniques that we talked about earlier with COPD, like postural drainage and percussion, those would be helpful here too, right?
Exactly. Those techniques can help to loosen and remove that thick mucus from the airways. And some patients might also benefit from airway clearance devices like those oscillating positive expiratory pressure devices, the OPEP devices.
Okay, so we've got those mechanical methods to help clear the airways. What about medications? Are there any specific drugs that are used in the treatment of bronchiectasis?
Antibiotics are really important, especially during acute exacerbations or when there's evidence of an active infection. And in some cases, long-term prophylactic antibiotics might be prescribed to try and prevent those recurrent infections.
Yeah, that makes sense. With all that mucus just sitting there, it's prime real estate for bacteria to set up shop and cause problems.
Right. And choosing the right antibiotic often depends on the specific bacteria that's causing the infection, which can be identified through sputum cultures.
So it's important to send those sputum samples to the lab to make sure we're targeting the right bacteria with the right antibiotic.
Precisely. And in addition to antibiotics, we might use other medications like bronchodilators to help open up the airways and mucolytics to thin out the mucus and make it easier to cough up.
So it's really a multifaceted approach, targeting both the infection and that underlying airway obstruction.
Exactly. And patient education is key. Teaching patients about their condition, how to manage their symptoms, and the importance of sticking to their treatment plan. That can make a huge difference in their quality of life.
Absolutely. It's about empowering them to be active participants in their care.
Exactly. And don't forget about the emotional support. These patients are dealing with a chronic condition that can really impact their lives, so being there to listen, validate their concerns, and provide encouragement can go a long way.
Couldn't agree more. Now we've covered COPD, asthma, and bronchiectasis. What's our final stop on this deep dive into chronic pulmonary diseases?
Let's finish with cystic fibrosis. It's a genetic disorder that can have a really profound impact on the respiratory system and other organs as well.
Cystic fibrosis. It's a serious condition for sure. I'm ready to learn more about it. What are some key things that nurses need to know about cystic fibrosis?
Cystic fibrosis. Okay, let's break it down. What is cystic fibrosis exactly?
So cystic fibrosis, or CF, is a genetic disorder, and it mainly affects these things called exocrine glands.
Exocrine glands. I vaguely remember those from anatomy class. What do they do again?
They produce mucus, sweat, and digestive juices, those kinds of things. And the problem in CF is that these secretions, they become abnormally thick and sticky. Ah, so thicker than normal mucus. Got it.
Right.
How does that specifically impact the respiratory system, though?
Well, it all comes down to this gene called CFTR.
CFTR. Now,
Okay.
it's a mouthful.
Uh-huh.
But basically, this gene helps regulate the movement of chloride and water in and out of cells. And in CF mutations in this CFTR gene, they disrupt that balance, leading to that thick, sticky mucus that we talked about.
So because of this faulty gene, the mucus becomes all messed up and causes problems.
Exactly. And in the lungs, it's a real problem. That thick mucus, it clogs up the airways, leading to blockages, repeated infections, and this persistent inflammation. It's a cycle of damage that can eventually lead to irreversible lung damage and even respiratory failure.
Wow, so it sounds like managing that mucus buildup would be a major focus in CF care.
Absolutely. A cornerstone of CF management is airway clearance techniques.
Oh, so similar to what we discussed with bronchiectasis.
You got it.
Yeah.
We use things like chest physiotherapy, postural drainage, and even these special devices that vibrate the chest wall to help loosen up the mucus.
So it's like a daily routine for many CF patients. It can be, yeah. And there are medications, too, that specifically target that thick mucus.
Oh, really? Like what?
Well, there's a class of drugs called mucolytics, and they can help to thin the mucus, making it easier to cough up. And then there are these newer medications called CFTR modulators. They're pretty exciting.
Yes, CFTR modulators. Those sound high-tech. What do they do?
They actually target the underlying defect in the CFTR protein, the one that's causing the problem in the first place.
So they're kind of like trying to fix the root cause of the mucus problem.
Yeah. It's not a cure, but they've really shown some incredible promise in improving lung function and the overall quality of life for a lot of CF patients.
That's amazing. Sounds like CF treatment has come a long way. So we've got airway clearance medications to target the mucus.
Wow.
What else is important for nurses to know when caring for CF patients?
One thing to remember is that CF isn't just a lung disease. That thick mucus, it can affect other organs too, especially the pancreas.
The pancreas,
Right.
It's involved in digestion?
Yeah.
How does CF affect that?
So the thick mucus, it blocks the ducts in the pancreas, preventing digestive enzymes from reaching the intestines. And this can lead to problems with digesting food and absorbing nutrients, especially fats.
So malnourishment and vitamin deficiencies could be big concerns for CF patients.
Exactly. That's why pancreatic enzyme replacement therapy, or PERT, is so important. They take these enzymes with meals to help break down their food.
So it's a multi-system approach to care. We're managing the respiratory symptoms, supporting digestion and nutrition, and addressing any other complications that might pop up.
Exactly. And it really takes a team effort. You've got doctors, nurses, respiratory therapists, dietitians, social workers. Everyone plays a role.
Wow, it sounds like caring for CF patients is incredibly challenging, but also really rewarding.
It is. These patients face a really complex and often unpredictable journey. And nurses are often right there on the front lines, providing support, education, and advocacy.
And I bet emotional support is a huge part of that too.
Absolutely. Living with a chronic illness like CF can take a huge emotional toll. Nurses can be there to listen or validate their feelings and help them navigate all the challenges that come with living with this condition.
That's such an important reminder that we're not just treating a disease, we're caring for a whole person.
Exactly.
Well, we've certainly covered a lot of ground in this deep dive into chronic pulmonary diseases, COPD, asthma bronchiectasis, cystic fibrosis. It's been a whirlwind tour of the respiratory system.
It has, but it's so important for nurses to have a strong grasp of these conditions.
Absolutely. We've talked about the science, the treatments, the medications, but I think the biggest takeaway for our listeners, especially those future nurses out there, is to remember that human connection, that empathy, that genuine desire to support our patients through their journey.
I couldn't agree more.
To all of our listeners, thank you so much for joining us on this deep dive. Keep learning, keep asking questions, and keep those brains firing. We'll see you next time.